I wanted to share a brief introduction of what we're going to be doing today. We're going to be learning all about fillers today. And I'm going to be sharing a little bit about Revive, about our journey here and our medical team. I also will be giving you, I won't be, Lisa, our nurse practitioner, will be giving us some
We'll be
101
giving it
on
away,
filler.
yeah.
And
We're a
then,
lucky one.
yes. And an exciting live treatment, which I get to do every day. I'm really super excited to be able to share this with you all. And everybody who sticks around, we're going to have some special offers for you. And we're going to do a Q&A session. To start with, Revive Med Spa is a premier med spa here in San Diego. We've been around since March 6, 2006 is when we opened. So it's been 18 years.
Happy birthday,
to us. We just celebrated our 18th birthday. We're also a #1 provider for a lot of our leading brands in the industry, Allergan being one of them. And you can kind of look at the slide, you could see that we're also a #1 provider for Morphus Aid, Cool Sculpting. We have 10 locations now and getting ready to open up our 11th one in Laguna Niguel here in September.
Very exciting.
Yeah, very exciting. We're growing and you're growing with us. So thank you for that. A little bit about our team here, our senior lead team. We could start with Dr. Verma. He's our co-founder. He started this in 2006. I've been blessed enough to be with him during that journey. So I've been here for 18 years. Super excited to share the passion I have and Dr. Verma has, but he's our co-founder and medical director. As we've grown, I love the Roseville offices here. Sorry, distracted. We also have 2 other medical directors that have joined on since then in our NorCal area. We have Dr. Kim Rappaport. She's located in the Northern California region. And we recently just signed up Dr. Leaf Rogers, which is amazing. He's in the LA area. He's been able to help bring on some more services that we'll be able to offer you here very soon, more live events to come. But they're very talented and very attainable. You'll see Dr. Verma kind of running around here and he's seeing patients still and everything too. So very cool team. And we have a great leads and trainers, master injectors as well that help support them. Which brings me to my favorite injector, one of my favorite injectors, who's actually one of my injectors as well. So our model's very lucky to have her with us today, and she's going to share some of her knowledge that fillers that she has. She's been with us for over 7 years, very advanced injector. She does an amazing job, what we call, quote, liquid, unquote, face, liquid facelift. She's amazing at it. She's, again, my injector, but Lisa, you want to say hi?
Hi, everyone. I'm so happy to be here and I'm happy to be part of Revive family. Yeah. And happy birthday again to us and I hope for many more.
Yeah, definitely. We're going to start with some questions of dermal fillers that we have. Most popular questions that we usually get. So hopefully Lisa can shed some light on some of these questions. One of the questions we commonly get is, what is dermal HA filler?
Yeah, so a lot of people ask, what is dermal filler? And dermal filler is the gel-like substance that we inject beneath the skin. It's naturally produced in our body, and that's why it's pretty safe to inject. Our body pretty accepts this. So that's pretty much it. It's pretty simple. Just a little bit of hyaluronic acid and lidocaine for pain. Yeah, so you feel a little bit more comfortable.
And what is that used for?
So we use facial fillers for facial rejuvenation, volume loss, facial balancing, facial symmetry, defined jawline, elongation of chin, fine lines and wrinkles, and many more things that we can do, and even facelift we can achieve with that. So
yeah, it's one of our most popular of many services that we do, but definitely the most popular. One of my personal favorites. I've, again, free to share with you all that I've done, but I've done it all. But dermal fillers is one of my favorites. It's a quick fix. I like the quick fixes. How long do dermal fillers last?
Filler lasts about 6 months to 2 years. It depends on how many fillers we inject and depends on your metabolism, of course. The more fillers we have in one area, the more it's gonna last.
Yeah.
Yeah.
I'm one of those people too that I'm very active, so I metabolize it a little bit quicker. So I go along more of the 6 months to a year. Although I've been doing pretty good with my my cheek filler for now a couple of years.
Yeah, but if it's your first time, we achieve the goal, we've injected enough, then we're just gonna maintain it every year and see. And I don't think we usually use as many syringes the next time because I don't think it's gonna go back to the baseline. So, maintenance is the key to stay young.
Got it. And then who is the filler for? What
Fillers
type
are
of patients?
Fillers could be used for anyone, anybody who's above the age of 21. Again, it depends on the client's goal too. What are we trying to achieve? Do we trying to look younger, more refreshed, or are we trying to get rid of some of the lines, or we trying to enhance our lips or snatch our jawline? So depends on, and then we'll decide and go through the treatment plan of what we're gonna use and who we're gonna use them for, yeah.
And oftentimes too, I know you hear like, I'm going to be 52 next in actually a couple weeks. So, oh, usually you go, oh, 52, that's like the good, candidate for it. But oftentimes when we have younger patients that come in, we really are here to accentuate and really balance. If something may be a little off balance, we can balance off their face with the filler and or enhance those beautiful features they already have. And that's what we find with the younger patients that come in. For me, I do everything from my temples to my cheeks. My snatch jawline.
You look beautiful.
Thank you. You have a great injector. But also too, I've had my neck done, and we do it in definitely a lot of different areas. One of the other questions we often get is, are there different types of fillers?
Yes, and we actually just got a question too. What kind of fillers? What's the difference between the fillers? So we do have a collection of different fillers. We do different companies provide a collection of fillers, and then from that collection of fillers, we can choose from the thickest, more robust, to the softest, thinner filler, and depends on the area, depends on the type of the skin.
Yeah.
What we're trying to achieve, we choose the appropriate filler. So if we want to achieve volume or provide the structure of the jawline or the chin, we're going to use something more of a robust product like Juvederm Voluma or Restylane Contour or Lift or RHA4. So, and then if we want to use something for some finer lines, we can use something like RHA Redensity or Rubella or Restylane Refine. So depends on the area, depends on the skin. We'll choose the right product from the right collection.
So I have another question. It might be a trick question for you. How do I choose the right filler product?
So we can definitely discuss that, but most likely we're gonna choose the filler that is appropriate for your skin and, like I said, for the area, because we don't want to inject something robust like something like Voluma or Volux into the lips. I mean, it's not gonna be natural, and it's gonna feel really hard and not natural. So
yeah. My trick question was, I said I was going to pick the filler. Actually, your provider is the person that wants to pick that you want to pick the filler. But yes, anything I basically sit in the chair and say, what would you do with me? And what, trust that your providers are very trained here and do an exceptionally good job on picking the right ones for you.
And I like when clients come in and they already have done their homework, which is actually really nice. And then we kind of dive in more and educate them a little bit more. It's easier actually. So if you guys can do your homework beforehand, that's great.
Saves time. Another question that we see here is, are there risks or side effects with filler?
So any medical treatment, we do have obviously risks and side effects. With the fillers, most common side effects would be bruising, swelling, soreness, but it's all should be resolved within 2 weeks. We definitely wanted to assess your medical history and make sure you are the right candidate for the treatment. But for the most part, if you are healthy, and most likely the most you're gonna have is some bruising, swelling, sometimes no bruising, a little bit of swelling.
Yeah.
So.
Yeah. One of the things I love about filler is that it's a minimal downtime. It's very non-invasive as opposed to, doing some kind of surgery or something. So I'm very happy to be a filler patient, actually. Another question I always get when, I'm trying to, talk about our business to my girlfriends is it painful?
Yeah, that's a common question people ask. Well, if we have a needle injecting in the face, so it's a little bit uncomfortable, but every filler has the lidocaine in it, which is the numbing substance that helps, comfort you as we go with the treatment. Obviously, everybody have their own pain tolerance, so somebody is a little bit more pain tolerant than others, but we can also use the numbing cream as well too. But it's pretty comfortable for most people.
Yeah. I feel like sometimes when I get my lips done, it's a little spicy, but we do use the numbing cream. But the rest of the areas, I'm just like, that we don't use numbing cream at all. I think maybe the deeper you go, it's a little
Yeah.
more comfortable for
And
me.
you're right, Christina. I think the lips are probably the most uncomfortable part of the face that
So
people are
worth it.
complaining. Yeah.
This is one of my favorite questions on the slide that we always get are, things we like to explain to people is how much filler is in a syringe? And I wanted to show you guys a syringe. This is a syringe.
Which is 1 cc, 1 ml of filler, which a lot of people think that it's a lot and they can do a lot of with one filler. But if you take those, if you take 5 syringes and put them in a teaspoon, that's all you're gonna get is a teaspoon of gel. So that's how much filler, if we need a lot of volume, then we're gonna need a lot of syringes.
Yeah. And I think for me too, when I really started getting educated about how much filler was in a syringe, one of the things that was impactful is hearing that one syringe is equivalent to a blueberry. So half a syringe is equivalent to half a blueberry. And then try putting that all over your face. It's really not a lot, but I like that it's one syringe is conservative enough to see you go from, gradually get to your outcome.
Yeah, it's important to understand what's the outcome and what can we achieve with 1 or 2 syringes. I think that's kind of important for injectors and for the clients to understand. So they're ready for the journey. Yeah.
And these are just some before and afters of some areas that we're able to inject. And you can see some of these are obviously our patients or in-house staff that we've taken befores and afters with. We've kind of gotten to the stage of where we're going to go ahead and have Lisa talk with our model who's been able to join us today, who's actually, her name is Mia, and she's getting ready to get married in October. So we're really excited to have her today as a model. And she's going to go ahead and assess her. And then what I can do is I can, as your guys' questions continue to come in, I can ask her for it after her assessment with Mia.
Yeah, you feel free, guys, to chat, ask questions, and while I'm injecting, we can talk and chat. Okay. Hi, Mia.
Hi.
I'm excited to have you in my chair today.
Thank you.
So, what I'm gonna do is I'm gonna give you a mirror. If you could please pass me. So this is my first thing that I wanna, I want you to ask you, have you been injected before? And what's your common concern, or what would you like to enhance or fix or anything?
So I haven't had any filler done before. I've had like Dysport and Botox done, but that was about it. One area that I'm really wanting to focus on, I would say, is kind of like the mid face down. I really want this area to be more snatched, I would say, like
That's a good
especially
word.
for, like those photos. I feel like the side profile is just like a little pushed in, and this can have some love.
Perfect. Yeah, absolutely. Yeah, and I'm glad you're doing it. Your wedding is in October, right? So
Yes.
that's one of the things. If you guys are married tomorrow, please don't come inject it today. Okay, so we have a few weeks or months to recover and go through the swelling. So as I'm looking at Mia's face, I'm gonna look at her from all different views. And obviously, we already have taken pictures of all different views of of our client, beautiful client.
Thank you.
So what I usually, how do I usually assess the face is, I'm looking at the front view and I'm dividing her face in three portions, on the upper, middle and the lower. And I want to make sure that all the portions about the same size. So when we look at her lower face is a little bit shorter, chin's a little bit retracted. So I think to give a little bit of elongation and projection would look really good by balancing her face and her profile. Her lateral cheeks could be a little bit lifted, and the mid face could be a little bit volumized. That will give her that more restful and a natural restful look. And a lot of clients have come in and have told me that they're looking tired and they want to treat their under eyes. But a lot of the times, what happens is that we lose some volume in the mid face. So when we kind of provide that, you're gonna look a little bit more rested. Okay. So definitely, we're gonna use some of the products, and we're gonna use the Restylane collection today. And our most robust Restylane product is Restylane Lift, something that we're gonna provide a little bit of structure, right? So laterally, we're gonna do the Restylane Lift, and immediately we're gonna do Restylane Contour, which is a little bit more, it's a little bit more stretchy product, so it's good for smiling. And then this part of the face we use, obviously, so it's gonna look more natural. And as far as the jawline, the Restylane Lift as well. And down her to her jowls, I'm gonna use the Restylane Contour to provide even more, basically contouring as as the product's name. For the chin, again, we're gonna use the Restylane Lift to give her that length. With we can either use Restylane Define for her marionettes and mental crease, or Restylane Contour as well. That would be really good. So if you agree with the treatment, so we're gonna focus on her mid face, on her jawline, and her chin today. So if you agree on that, we can go ahead and get started, right?
Absolutely, I'm in your hands.
Very good. Okay, so and Sarah already cleaned the face, right? So we're gonna go ahead and start, right?
Okay.
So I can get your. Yeah. I am going to use, start with the Restylane. Yeah. Restylane Lift. It's our more robust product. And I usually like to use a combination, sometimes with the needle injection and the cannula injection. I don't know if you know what cannula injection is.
It's like a blunt.
Blunt
Okay.
needle, yeah, so it's usually used to minimize the bruise and swelling.
Okay.
It's a little bit safer. I do like to use a bone injection just to give that better structure.
Yeah.
So first, we're gonna start with the needle injection.
Okay.
Can we give her some ice too before we start?
Lisa, while you're injecting, I can ask you some of the questions that are coming from our audience today.
Yeah, go ahead.
Someone is, Tracy is asking, what filler is best for the lip lines and how many syringes is common?
Lip lines, if we just focusing on the lip lines, we're gonna be using something softer, something like Volbella or RHA Redensity. Probably starting with one syringe would be a good start. I don't like to use more than one syringe in the lips. Yeah.
From Leanne, she's asking, can we do filler with microneedling?
I'm sorry?
From Leanne, she's asking, can you do filler with microneedling?
Well, if you do filler, if you do microneedling, I would do, you could probably do filler right after, but if you do filler first, I would probably wait about 2 weeks just to let your face heal. And it's not good to do that when you're all swollen and bruised.
Awesome. And then Alina is asking a great question. Is being on baby aspirin okay when getting fillers?
I would avoid baby aspirin as baby aspirin, ibuprofen, alcohol. It's all those things can thin your blood, so potentially cause more bruising and bleeding.
So pass on a glass of wine the night before.
I would. I mean, it's. Of course, you if it's necessary to, to continue getting the medications, absolutely. But just know that you might get more swelling and more bruising.
Kristen is asking, to get the snatched look, would you recommend doing fillers with PDO thread lips together?
1 second, can you put the chair down for me so if it goes down more? Can you repeat the question?
Yeah, no problem. To get a snatched look, would you recommend doing fillers with PDO threads?
Well, PDO fillers and threads, of course we can combine threads and fillers, but threads, you have to go through assessment. We have to make sure that you're the right candidate for, not everybody is a good candidate for threads. Okay, you ready?
Yes, ma'am. These are great questions. Please keep them coming. Here's a good one. What would be the best filler for smile lines? In the Restylane? Question mark?
Is a good filler,
Yes. Perfect.
but Restylane Refine would be a good one. Restylane Kiss, Restylane Define, Restylane Classic. Depends on your type of the skin. So, what do you feel? Are you doing okay?
Oh, yeah.
Whatever before I use my camera.
Okay. Here's another really good question. How long after my third Morpheus 8 treatment can I get filler?
I would say all the procedures after Morpheus 8, I would wait 2 weeks for just to let your face. You could do it sooner, but after the injection, I would definitely wait 2 weeks for any procedure. After the procedure, it depends on how well you healed. Yeah, you could do it sooner, but I would definitely wait till your face is less, more healed and everything. So.
Yeah. Kelsey asked a very good question as well. She goes, how can Botox and fillers work together to balance uneven face, such as cheekbones?
It's a good question. So they work differently, obviously, but you can't really do Botox to improve the cheekbones, but you can help to define your jawline, lift your brows. What was the question? Is it, can you lift the face with the Botox?
To balance uneven face, such as cheekbones.
Sometimes it depends on, yes, if there's a smile and a muscle, yes, sometimes we do correct things with the balance things with the Botox if it's muscle related of the asymmetry, yes. Yeah.
After getting lip filler, is it advised to no longer use a straw or not to use one for X amount of time?
After filler? I get the question a lot.
Mhm.
I mean, there's nothing really gonna move the filler. I mean, you might be uncomfortable eating something or drinking because your lips are sore, but there's no reason not to. It's not gonna move the filler. Um, just like right after lip injection, make sure you keeping it clean and not putting your dirty hands on your lips, so just so we can avoid infection.
But there is no negative
I-
to using a straw.
I don't think there's negative
Yeah.
things, no.
How many syringes do most people need for the chin? Thanks, Kim, for your question.
I mean, obviously, everything depends on the person, but and depends on how retracted is your chin and what's the goal. Sometimes 1, 2, 3 syringes, I would say. Like I said, if it's more retracted chin, I would probably say more product than not. But I would say if it's somebody who's really retracted chin, I would say 3, sometimes even 4 syringes, yeah.
Carrie would like to know, how many syringes do you think you will use on Mia for her chin?
I would say 2 to 3 syringes, probably, and then we'll bring her back when she heals, and if we'll reassess and see if it also depends on if she wants, what she wants to, what she wants to be a little bit, if she wants to have a more pointed chin, or, but I think today will be good for about 2, 3 syringes, yeah.
Awesome. 2 to 3 syringes. Molly would like to know, how long do you have to wait to exercise or perform strenuous movement after filler? I always ask that question too. I think it's such a great question.
I'd say 24 to 48 hours. If you feel, depends on how many syringes and how sore you feel, I would say, if you've gotten a lot. Let's say if I treated somebody's full face, I did a complete facelift, I'd probably wait 48 hours because you're gonna be sore, chewing, even sometimes moving your head, you might have some headache as well after getting insured. So I don't think it's gonna be comfortable for you to exercise anyway. You don't get an nurse on the floor. How are you feeling?
Good.
It's so fun.
Yeah. Now, the fact that he's asking, besides Voluma, what other fillers can be used in the cheeks? Because today you're doing a different filler
Yes.
from a brand, right?
Perfect, that's a good question, yes, so, like I said, we have, today we're using, Galderma collection, which, for the cheeks, we're using Restylane Lift and Restylane Contour. If I would have chosen the, Allergan collection, I probably would use Voluma. The Voluma probably would be my choice. If it's preauricular and area, depends on the skin. I probably use either Voluma, or if I want to smooth stuff out, like balance more everything out, I could use Contour for preauricular area as well there.
So you have a lot of different tools on your belt that you can use depending on people.
Yeah, and I'm so glad that we have that, because I mean, when we started out, it was only 2 products, the fillers, that they've done everything. I think it was Juvederm and Juvederm Plus, and they did everything. They did the cheeks, the chin, everything.
Yeah.
So now we have a lot more tools and toys to play with.
Terry asked another good question. Is there a maximum amount of syringes you can use on one person in one day? I mean, I know that I've received 6 in one day at some point.
I mean, there's not really amount that is dangerous if you to use, but depends, I mean, it also depends on your budget too. As far as dangerous, it's not dangerous, and you can, if you can how much, how can you handle it as far as paying? Can your wallet handle it in one treatment too? That's another thing. But you can do as many syringes as you can possibly tolerate in one treatment. I think the most I did in one sitting is 18 syringes, so.
It can vary.
But if it's the first time, if it's your first time, I probably would start off maybe a little less.
Yeah.
Just to make sure that you're healing and you tolerating and, you know, you're not developing any kind of reaction, so.
Yeah.
But if you're healthy, there's no reason. So I'm gonna go ahead and use the cannula right now, and we're gonna go ahead and treat the mid face with that as well, okay? So you're gonna have a little poke, so just relax.
Here's a really good question from Stina. Interested in filler for mid-cheek roof. Will it make my cheeks look even bigger when I smile?
It depends, I mean, no, if we want to just provide, if the mid face, we just wanna give you the volume back that you lost, so. We wanna make sure that you look natural as possible. If it's done right, you should not be looking weird or cheeky or anything like that, you know?
Kim, great question. Let's say you needed 3 syringes for the chin. Then what would be the maintenance to be required to keep that look? 1 syringe a year or?
Depends, probably, yeah, or maybe, like I said, depends on your metabolism. Maybe 1 syringe every 1.5 years, 1 year.
These are great questions. Thank you everyone for keeping them coming.
Said earlier, I mean, sometimes people, they hold the filler pretty well.
Would you recommend a lip flip versus a lip filler?
It all depends on what are you trying to achieve. The lip flip only lasts a few months because it's affect the muscle, so that's why you get the lip flip. Are you doing okay? If you want, you could achieve the flip with the filler as well. If it's not, sometimes if we wanted to kind of outward the lip, you know, we have some kind of lips that they look inward and it's harder to open with the filler. The combination of both would be really good, but you could definitely do just with the filler as well. I mean, again, it's all kind of personal too, and we have to see and assess the lips.
Yeah, I like to do both. I like a little bit of accentuating my lips and then a little bit of a flip. Oftentimes I think those two kind of go together really well.
Yeah, I mean, if it doesn't, for sure, it's not wrong, but I mean, sometimes people start off just, they start off with the lip flip just to see how they like the look a little bit, and if some girls are not ready for the filler, so that's a good start to see if you like to continue with the treatment. Okay.
Yeah. Lizette has a good question. I feel like we hear oftentimes in houses, would under eye filler reduce the darkness under the eye or just fine lines?
It doesn't affect it could affect usually the under eye filler, it just helps with the hollowness under the eyes. And the way the lights on the eyes, sometimes it does help with the dark circles for sure, because the deeper indentation we have, the darker they look. So if we kind of provide the support of the under eye, gives a little bit of volume and help with the hollowness, so it definitely will help with the darkness for sure. But it's, you know, but it's just because of the volume, not because of the color, if you know what I mean.
Yeah, kind of like when my temples get done, the shadow.
The
sometimes
shadow,
is
exactly.
It could look like it's deeper than what it is. It does improve on the lightness
not
and
the
brightness.
Good.
People ask, how many syringes for marionette lines? It depends on.
It
the
all
patient.
depends, and then, you know, the marionettes is a direct facial volume loss. So when we start to age, you know, everything kind of comes droops into the middle, and also we get those marionettes, gels. So I would start off probably, depends on, again, I have to assess the client, but we would probably have to lift and provide volume to the cheeks, to the jawline, to lift that, and then if there's still anything to fix, then we could directly fix, inject the filler into the marionette.
Another good question. Is it good to start with the cheeks?
Yes, the cheeks are always great. Mhm.
And why?
Well, like I said before, we wanted to give that, you know, volume back. We want to lift, you know, provide that lift, that skin that kind of goes and makes us look like a, some people say bulldog, you know, kind of. So we want to get that skin and lift it all up and then directly go and treat the area. Because if we go and start treating the marionettes or the jowls, we could look very heavy if we don't lift the cause, you
Yeah.
know. So,
And oftentimes fixing your mid face first corrects some of the lower face from the volume loss that you're facing.
absolutely, absolutely. What are you doing?
I've seen some people get fillers and travel, their faces swell up from allergic reaction while in flight. Is that common?
Yeah, that, I mean, that's one of the things that we recommend, not to fly after the injections. I mean. Yeah, so I would not recommend to get fillers and then get on a flight, because I mean, we get swollen, and even without the injections, we get swollen.
That's true.
So, but if you do have to fly, I would recommend to get, maybe get some antihistamines. And, but it will all resolve, but it will definitely can be more swollen for sure.
Lauren's asking the same question I asked a couple weeks ago. Do you feel cleavage wrinkles?
Cleavage wrinkles, we could use collagen biostimulators like Sculpture or Radius for that, yes. Even filler we could use, I don't see why not. Skin Beef would be a good product. Yeah, definitely, definitely.
Teresa's asking another good question. These are all great questions. Thank you. Thoughts on Sculptra in comparison to dermal filler? It's a very good question, because it seems to be the Sculptra being a biostimulator, it seems to be very popular right now, and people might not understand the difference between the two.
Yeah, so Sculpture, it's a substance that, I mean, biostimulator, we inject it and then it causes stimulation of your own collagen. So it's a little different than, think of fillers as like, it's a gel, and Sculpture is something that will stimulate your own collagen production and form more fuller face, and skin becomes firmer. And so when you look at the baby, the skin looks very soft and smooth and full, even 1 second, even after. I'll ask another question. Can you say it a little bit for me? Yeah, look at that. Yeah, so Sculpture would be something, we start losing our collagen after the age of 30 dramatically. So if you look at yourself at the age of 20 and compared to 30, you lose a lot of volume and collagen. So the sculpture is a good way to kind of restore that volume and texture and things like that. Yeah. Okay.
You can also use those in combination.
Of course, combination is the key. I think both of this. And sculpture doesn't, sculpture will take it's not immediate result like fillers. Sculpture will take 3 to 6 months to see results, and you probably will need more than just one treatment. But the younger you are, the better, I think the less treatments you probably will need, so.
Another great question, that Terry's asking, can you do, this is for me, can you do the hands for wrinkles?
Of, hands for volume, yes, and a little bit of wrinkles, absolutely, with fillers. And or radius, or, yeah.
That was really life-changing for me on my hands when I got them done. I was really super excited to see how much more useful my hands.
That's good, okay. So far we used 1 syringe of contour and 1 syringe of lift, right? Let me see. Just go ahead and start, and I'll do the other side. Or how do you, do you want to do one side?
Yeah, so then we can take it before, or.
Okay. Can I get one more list?
So how do you decide between Sculptra and filler on a patient?
I think I would not decide. I think I would choose both. But it also depends on the client. I mean, do you want to see the volume restoration right away? Do you want immediate results, or do you want something more gradual? Which my recommendation, if you can, I would do both, because sculpture will also help you with that texture and tone, and the fillers provide the volume also. By the time the fillers start to subside, you start to see the sculpture. So I think that both of them would be really good to use if you can.
The instant gratification you get from the fillers, where Sculptra you have to wait 6 weeks and then
do another treatment.
Another treatment,
Yes,
yeah.
yes. But absolutely, if the client can, I would do both. That would be the best, because we give the volume, we give the structure, and also get that beautiful glow with the sculpture. Exactly.
Agreed. I was asking if, does the filler dissolve completely where it is placed, or can small deposits move elsewhere as it breaks down?
If it can migrate, is that the question? Kind of like
She was asking if it dissolves where you put it, if it stays where it's put.
I don't quite understand the question. If it's dissolved at the state food, or
I think as it wears off.
I mean, it's gradually, yeah. Well, wherever you placed it, that's how it's gonna be. That's how it's gonna be absorbed and dissolved. Yeah. I mean, potentially, can it be moved a little bit in the surrounding area? Yes, it could, for sure. But if you, like I said, if you choose the right product, you use the right placement, and but it shouldn't be much of a migration. So it's pretty safe if you worry about the migration.
Thank you, Kim. That was a good question.
Ready? So we're choosing a drawing. And actually, that's a good. Aspirated, and I got some blood in it, which I haven't gotten in so long. So that's how important it is to aspirate. Do you okay? Are you okay? Cheese. And that's how important it is to aspirate, because if you don't aspirate, you can get into the vessel.
Of
Yeah.
going to a very good injector who actually does follow all of the procedures to make sure your safety is really important.
Well, I haven't gotten that in a few years.
Kristen wants to come in today and get treated. Hot dog, let's
Come
go.
on, come on.
Megan wants to know, how long before should I get a lip filler touch-up? Thank you, Terry.
I mean, depends how, if you want a fuller look, you can, anytime, to be honest with you. At some point, some people do their lip filler too often. And it definitely start to migrate, so the best thing would be to dissolve the lips and start over.
If they do it too much.
If you do too much too often, yes.
What would you consider a touch-up? 6 months or year?
I would say, if you're happy with your size, I would say 6 months to a year, yeah.
Molly's asking a fantastic question, and I think we're gonna be wrapping it up here. What are some questions we should be asking our injector to make sure that they're knowledgeable in treating us? And I think it's important also to do your homework and make sure that, you know, it's a place that continues to invest in educating, ongoing education at most with your providers. And I think we definitely at Revive really stress on education and safety protocols are most definitely followed on the day-to-day, and Lisa is one of our trainers that goes and makes sure that that's happening with our team. She's one of the trainers that teaches everybody, but I'm gonna let you, Lisa, answer that question as well for the viewers.
Repeat the
Yeah.
question.
What questions should they be asking their injectors to make sure they're knowledgeable on treating?
Well, I think that, I think it's important, first of all, obviously, knowing, I think it's important to see the knowledge of when the injector is, the injector have to assess your face and go through a treatment plan. I don't think it's good when you come to injector and you say, you know, I want this, and injector goes and then, I want my nasolabial folds. And injector goes and inject in nasolabial folds. I think it's important that the injector goes through everything, through all the options that they have, and then come up with a treatment plan. And after that, then you guys go ahead and kind of like accomplish, you know, trying to achieve your treatment plan, and goes and explain the differences between the fillers and what you need to do before and after the treatment is so important. But the treatment plan and going through everything that you could get and achieve, that's important, I think, yeah, for sure.
Awesome. All right, unfortunately, this has been an amazing time, but unfortunately, we're gonna have to wrap it all up. Happy to get some suggestions on any future live events that you would like to get some education or information from. This is really fun for us. But please be sure to follow us on Instagram, TikTok, and Yelp. You guys have been amazing, great questions, and we're gonna go ahead and show you a split face of what Mia looks like so far, and then we'll definitely find a way to post her on Instagram to give her the final results when she comes back in for her checkup.
I mean, so far, and we will post the pictures before and after, since we didn't have enough time, but I mean, so far you can see that we have a nice lift of her right cheek and fullness, and I mean, we haven't completed the jawline and the chin, but you guys can see that in the before and after pictures. But so far, she definitely looks more refreshed and lifted, and
Yeah.
almost ready for her wedding.
Halfway there.
Halfway there, well, a little bit less than half, but thank you, everyone, and yeah. Feel free to ask questions, Instagram us, DM, yeah.
Lisa is here at the Mission Valley location and I'm kind of everywhere. So I hope I get to see you all on the in the stores and around. Thank you so much for your time and all of your great questions. It's been really fun and can't wait to the next one.